Welcome to Mary's PACE program. At least Mary feels like it's her PACE. She enrolled a year ago when she learned about the program of all-inclusive care for the elderly, PACE, or LIFE as it's called in some states. Mary loves PACE. She feels secure knowing a team of professionals is focused on her care. What Mary doesn't know is that her PACE relies on its own team of experts, Tabula Rasa Healthcare, or TRHC, and its suite of PACE-specific solutions, CareVention Healthcare. In fact, more than 90% of all PACE organizations rely on TRHC for at least one service. Even before Mary's PACE opened, its sponsoring organization turned to Tabula Rasa Healthcare. CareVention Consulting, a PACE Technical Assistance Center, or TAC, has guided the organization every step of the way, including feasibility and market studies, submitting CMS applications, training staff, and now operations and growth. Pharmastar is also an important partner to a potential PACE. A pharmacy benefit manager, or PBM, the Pharmastar team helps the organization complete its Medicare Part D provider application, a key step towards gaining CMS approval. Once the PACE program opens its doors and enrolls participants, CareVention Healthcare's suite of PACE services and solutions will support operational efficiencies, regulatory compliance, and participant care. Mary's program chose PACE Logic, a scalable technology platform designed for the unique needs of PACE. PACE Logic supports care planning, home care, and health plan management capabilities. With more than 130 compliant templates, PACE Logic simplifies monthly reporting to CMS. Whenever a participant visits the PACE clinic, their medical provider uses PACE Logic to document details of the encounter. Providers understand the importance of fully documenting each patient encounter. PACE programs receive payments from CMS based on the conditions each participant is treated for. Physician consultants from Capstone Risk Adjustment Services trained the providers on clinical documentation for PACE. The risk adjustment team also audits the program's charts to ensure accurate documentation and, consequentially, proper payment and compliance. When a participant needs medication, the PACE provider will order it from CareKinesis, CareVention's medication management and pharmacy service. Every medication ordered is reviewed by a clinical pharmacist board-certified in geriatric pharmacy. The pharmacist uses TRHC's proprietary MedWise technology to analyze how medications interact with each other in a participant's drug regimen. If a participant is at risk of an adverse drug event, the pharmacist and provider can mitigate that risk, saving the program downstream costs on utilization like ER visits and hospitalizations. The participants' medications are shipped to their home or PACE center. The special adherence packaging makes it easy to know when to take a medication for greatest efficacy and safety. And since the cost of medications is covered by Medicare Part D, Pharmastar will submit the Part D claims to CMS for payment. Sometimes a PACE participant needs to see a medical specialist or go to a hospital emergency room. Peak TPA adjudicates these claims for PACE and ensures those providers are paid. Peak TPA also submits monthly risk adjustment, encounter, and enrollment data on behalf of PACE to CMS. CareVention Healthcare truly is the one partner a program needs for PACE success. And just as Mary and other participants feel cared for by their PACE program, their PACE team knows they can rely on TRHC and CareVention Healthcare.